Coronavirus cases surging dramatically across the state of Indiana. Today we'll talk with Dr. Deborah Birx from the White House Coronavirus Task Force and with former State Health Commissioner Dr. Judith Monroe. Plus, legislative leaders on both sides of the aisle talk about what's to come at the Indiana State House. It's all ahead this Sunday in Focus.
Exploring the issues that matter most in Indiana. This is In Focus with Dan Spieler.
Good morning. I'm Dan Spieler. We start with the coronavirus crisis. Governor Eric Holcomb under quarantine this week after being exposed to the virus within his security team. Thankfully, the governor and his wife testing negative. This as the state continues to deal with surging case numbers and record hospitalizations. We'll talk with Dr. Deborah Birx from the White House Task Force in just a minute. But first, Darius Johnson with the latest here in Indiana.
Everything is on the rise. Cases, positivity rates, and hospitalizations. But it's not just in Indiana or the Midwest. It's across the country.
It's not surprising. Typically, hospitalizations tend to be slightly lagging behind the test counts.
Dr. Sean Granis with the Regan Street Institute says things took a turn for the worse when the weather got cold and people started congregating inside.
So there are a number of viruses that are exchanged because we are in closer proximity. That is one primary driver of this exchange.
The highest number of COVID-19 hospitalizations in the spring was 1,799 on April 13th. 7 months later, there are 3,000 patients hospitalized. But what's different is the virus is no longer isolated. It's everywhere.
All of these should be wake-up calls and warning signs for people to continue to follow safety precautions.
What concerns me the most is this will be the first time sort of in this pandemic where we have kind of back-to-back events where people are very used to getting together as family.
Hosting smaller Thanksgiving and Christmas gatherings are simple steps we can all take to mitigate the virus.
We've got some critical time coming up that we have to be really vigilant and careful and do everything we can so that next year we're all here.
Reporting in Indianapolis, I'm Darius Johnson.
All right, Darius, thank you. Looking at the latest data here from Johns Hopkins this past week, kind of striking to see the difference there along our northern border. And you can see a lot of cases right here in the Midwest in our part of the country right now. We did hear from the White House Coronavirus Task Force, which held a press briefing for the first time since July, touting some of the good news we have seen in recent weeks on the coronavirus vaccines.
Literally, the day after one of these vaccines is approved, we'll be shipping vaccines to the American people, and within a day after that, we'll be seeing those vaccines injected into Americans, with a particular focus on those most vulnerable and those that are providing health care to the American people.
This week, I also had the chance to speak one-on-one with Dr. Deborah Birx from the White House Task Force.
There is that bright light at the end of the tunnel, but we need to get there together with as many Americans saved from this virus as possible.
Are you among those who believes that the Biden transition team should be brought into the conversation on the pandemic to ensure a smooth transition on the fight against COVID? And if asked, would you hope to continue serving in a similar role when the new administration takes office?
Well, I think your first point, to really understand that, I know that press for months has been talking about the governor's reports being secret. They were never secret. They went to governors and health officials in every single state, analyzing the data, ensuring that we were both seeing the same thing at the hospital level, at the county level, to really understand the information and then provide really a summary, which we do, and recommendations. I think it's very important that the transition teams get to see the data analysis so that there's a shared understanding of what's happening across the country, county by county, hospital by hospital, so that there's an understanding of why we've taken the strategy that we have in relationship to the states and how each state is doing and how important it is to have that really granular data. And I think that time will come and that transparency will be complete because we are very transparent with the governors and the state officials of everything that we know. We're not hiding the ball in any way. And I think you saw in the task force the open briefing. Now, I've been a civil servant for 40 years in every administration since Ronald Reagan, and that's really up to the incoming administration deciding whether I can be helpful to them or not. Certainly my long history of service, I would not leave in the middle of a crisis if it was felt that I was needed.
Finally, I want to ask about Indiana specifically. Just about all the states bordering Indiana have taken aggressive new actions in recent days with new restrictions. Our state has not gone to that same extent yet. Does more need to be done in that regard at the state by state level and here in Indiana specifically?
Well, you can see your numbers. And you can see that what we are talking about in Indiana and Indianapolis in particular experienced a summer surge that was very clear. But I want to make it just absolutely clear to the people of Indiana. What's happening this fall is the spread is more rapid. The rate of rise of cases is higher. The number of counties that are engaged in this rapid spread is equal, if not greater, than the summer. And the length that we've been in this degree of spread is longer than the summer. And so this is the moment to really do additional mitigation. There are things that the state can do to mitigate this virus, but there's also critical things that each of us can do. And all of us should be wearing a mask. We know it protects us. We know it protects others. We all should be physical distancing, but absolutely critical is we cannot have indoor gatherings with individuals that you don't know their viral status. And by looking at them, you cannot tell if they're infected or not. And to remind everyone in Indiana, we have done great improving therapeutics. And at one time, 30% of individuals over 70 that got infected succumbed to this illness. Now it's down to 10%, but no one wants to be that 10%. And so if you have people in your family with comorbidities or you have people over 70, this is the moment to protect them and to ensure that we all make it to next year together.
Dr. Deborah Birx with the White House Coronavirus Task Force, we thank you for your time. Have a safe and happy Thanksgiving. We appreciate it.
Thank you. Safe. We'll be happy next year.
All right. Now, this week, I also spoke with former Indiana State Health Commissioner Dr. Judy Monroe.
I know in Indiana, the hospitals are pretty overwhelmed right now, and we really have to think about the hospital staff, particularly. You don't want to overrun your hospitals. And so there might be a need for more aggressive. I applaud the governor. He's really modeling. I know he's in quarantine right now, and, he has had the mask mandate. And so that's all really, really positive.
All right, more of our interview with Dr. Monroe next week. Meantime, at the State House, lawmakers were back at work Tuesday for Organization Day with some controversy already over the issue of masks at the State House and a proposal to put an end to the governor's emergency health declaration. Kayla Sullivan has more.
The only two unmasked lawmakers at the State House on Organization Day are also pushing to end Indiana's public health emergency. Republican State Representatives Curt Nisely and John Jacob did not want to comment on either matter. House Speaker Todd Huston says there needs to be a discussion about the emergency order.
I think that there's a proper role for legislative input. I think, there needs to be a fuller and broader discussion about those actions.
Nisely and Jacob say Hoosiers are capable of protecting the health and safety of themselves and their families, adding the public has been educated on COVID-19. Therefore, a state of emergency is no longer needed.
It doesn't seem realistic to me at all, frankly. And again, we'll see where we are. I know we're getting very close to a vaccine, which is exciting, but we're in a pandemic. And again, the cases continue to skyrocket.
That's one reason House Democrats proposed a rule requiring masks at the State House. That was voted down along party lines.
That motion was just not well thought out and clearly written in a way that would have caused a lot of problems for a lot of members.
The state Democrats put this forward to really protect the health and safety of, again, not only the members, but the staff, the folks in the media, the public that comes into the building.
Speaker Huston says the discussion may come back up in January.
I have strongly encouraged, as you could see by our caucus, the vast majority of our caucus did wear masks.
From the Indiana State House, I'm Kayla Sullivan.
Well, this year, lawmakers have to pass a state budget and also need to redistrict Indiana's congressional boundaries. Senate Minority Leader Greg Taylor, who's new in that post, has a bill that would guarantee public input and stop lawmakers from gerrymandering and drawing districts that only take political parties and voter demographics into account.
With the high voter turnout, I think people are excited about voting. They voted more than they ever have in the past this year, and I think we need to seize that momentum going forward.
Both Republican majority leaders in the House and Senate believe the public should be involved in the process of redistricting. Lawmakers will officially start hearing bills in early January. Well, as for the presidential election, more headlines this past week as the president continues to try and discredit the results of the November election through a combination of legal challenges and other unfounded claims. We're going to be talking with our panel about all of those headlines coming up. Meantime, on Capitol Hill, Congress still has not been able to reach a deal on a coronavirus relief bill, just weeks until the new administration and new Congress get to work in January. Trevor Shirley spoke with one of Indiana's newest members of Congress, Republican Victoria Spartz. Trevor?
Well, Dan, good morning. On Friday, I spoke with Congresswoman-elect Spartz here in Washington. She's been here since last week for new member orientation. We talked about what Congress should be doing right now in terms of another round of COVID-19 relief and whether she views Joe Biden as the president-elect, something some Republicans still dispute. But first, I asked about her top priorities once she's sworn in.
Well, I think it's important for us to deal effectively with coronavirus and then start working on healthcare policy. It's always been my priority. I also would like to work on some issues on education and higher ed. I spent some time in the State House, but also been at college level.
Do you think Congress should get some kind of another round of relief bill passed by the end of this year?
Well, I think Congress should be doing the job and should be working, House and the Senate with the president and deliver the bill for sure. They need to work on it, have less politics, so hopefully they'll get it done. If not, I think we should be able to get it done next year, but I hope it will be done this year.
Do you, as an incoming member of Congress today, recognize Joe Biden as the president-elect?
We have to always let the process play out. Everyone is entitled to make sure that the process is transparent and then people have trust in the election. So I think we need to have the process play out. We need to have all states certified. It's a fair deal.
And Spartz will be back in Washington for another week of orientation after Thanksgiving. She then becomes an official member of Congress on January 3rd. Reporting in Washington, I'm Trevor Shirley for In Focus.
All right, Trevor, thanks. Coming up next this Sunday in Focus, we'll hear from Senator Mike Braun on that topic of the presidential election. And later, we'll talk about the potential impact of the entire NCAA tournament possibly coming here to the Circle City. Stick around.